Saundra Santiago. So a little background and demographics. Saundra is a 20-year-old female, and she's entering treatment because she has been in an abusive relationship with her boyfriend Eric since she was 17 years old. So for a little over 3 years now. So Sandra's presenting issues. Saundra is involved in an abusive relationship. This relationship is both abusive physically and verbally. Saundra refers to the physical abuse as that of slapping, punching, and choking. And she also states that her boyfriend Eric verbally abuses her, which consists of using, quote, derogatory and demeaning words and phrases, unquote. Saundra also has a loss of hope, which is evidenced by her stating that her life has always been hell and will always continue to be hell. She also has bruises on her right arm, left leg, and face. And it seems that Saundra has a poor social support. She doesn't have many friends and doesn't have a great relationship with her family. And she also seems to be unemployed at this time. Childhood trauma and adversity. Saundra had gone through a lot of various adversities through her childhood and adolescent years. She informed us that her mother was 17 when she gave birth, and she always felt like her mother never really wanted her and never really gave her the attention that she needed. Um, she remembers as she grew up that her biological father was always abusing her mother. She would hear the physical abuse and would also hear the verbal abuse from her bedroom. When Saundra entered her adolescent years, she ended up being molested by her stepbrother. At this point in time, she actually informed her mother about the events taking place, and her mother went and told the stepfather, and they both accused her of lying and beat her until she bled. At this point in time, she never ended up bringing up the situation again, although her stepbrother did continue to molest her. At the age of 15, Saundra ended up moving out into a group home, and this is also when she got involved with drugs and alcohol. So the first model that I thought, or rather the mid-level theory that I thought would be applicable to this case is the trans-theoretical model. This model focuses solely on the process of change rather than seeking to explain the causes of various social problems, which many social work models do seek to do. It also views change as a process rather than something that just happens overnight. Um, and lastly, it also really looks at motivation as such a foundational factor that needs to be assessed when working with a client. Because if the client has no desire to change, then regardless of the various psychotherapeutic modality one might use when working with the client, that client is less likely to see a successful outcome due to the low level of motivation. So that can allow the therapist or the social worker to assess where the client is motivationally and then choose methods or various approaches to apply to help increase or incentivize the motivation. TTM and Santiago. Um, so when looking at how this model will apply to Saundra, um, as I had talked about earlier, this model really looks at change as something that's not just a one-time event, but something that is a progression and takes time for change to occur. And due to the extensive trauma, especially childhood trauma, the sexual, physical, and verbal abuse that Saundra endured, and also the death of her brother and that grief and loss, um, I think that the outlook of this model, that there's nothing to be expected to happen very quickly and that it is going to take time really applies right here in this case. I also found that the fact that TTM incorporates various theories and they look at human behavior is something that's multidimensional, and the application of various theories allows social workers the ability to better address various issues. And two of the big theories in this model that are very prominent are humanism or client centered and also CBT. And I think that the client-centered approach here is going to be very vital due to the fact of all her trauma in her life. Her level of trust for individuals is likely to be fairly minimal. And as I stated earlier, one's level of motivation is foundational to this approach, this model. And it should be noted that the application of motivational interviewing can be conjoined with the trans-theoretical model and also the stages of change. And then you can use this motivational interviewing as a mechanism to help move clients from one stage of change to the next. Therapists should also be mindful that many clients are going to have some level of reluctance and ambivalence when motivational interviewing is being used. Implementation. Initially, I would really focus on the humanistic aspect of this approach and really develop some intentional rapport and trust with Saundra. I would also want to analyze the level of motivation that she possessed and also the stage of change that she was currently in. After assessing all that, I would then look at some of the processes of change that I could use based on where I thought Saundra was in the stages of change and her motivation. And two of the processes of change that I would be interested in using are helping relationships and self-reevaluation. Um, Helping relationships is really the belief that developing and maintaining behavior change is best fostered through having professional and naturally occurring relationships. So for Saundra, this might include group meetings for domestic abuse, church attendance, and therapy. Self-reevaluation challenges the client to view their life with and without the problem behavior, and in this instance, with or without Eric in her life. The second approach that I thought would be useful for this case would be the strength-based approach. And our text actually defines a strength as any internal and external resource and capability unique to each person or group. So this approach values the identification of strengths one has and encourages the harnessing and application of these strengths to overcome various adversities. When one is in troubling circumstances, it oftentimes is difficult for people to be cognizant of or recognize the past triumphs, potentials, and available resources to them. So here are some of the tenets of the strength-based approach. So for social workers, hope is very important, and it's easy for social workers to lose hope based on the adversity and heart-wrenching situations that we deal with on a daily basis. But hope for the social worker, it's vital for us to have that, because if we lack that, that's something that the client can pick up on, which can then impact the hope that they may have for themselves. Second tenet is cultural identity, and it's imperative that the social worker is competent culturally so they are able to identify and acknowledge various strengths of a culture that one might not be fully aware of that they have. And last is the tenet of collaboration, that this is a relationship that is mutual reciprocity, that no person is an expert over another, but rather this is like a joint effort to collaborate and set goals together for the progress of treatment. Implementation. The collaborative aspect of the therapeutic relationship created through the strength-based approach will allow Saundra to have a voice in the decisions involving therapy. I think this is very vital due to the fact that throughout Saundra's entire life, she's really been in controlling relationships, whether it was with Eric, that was a very physically and verbally abusive, or even in the relationship with her parents and her stepfather growing up, where she felt like she didn't have a voice. And when she did voice the trauma she was enduring with her stepbrother, uh, they didn't believe her, and they ridiculed her, and they verbally and physically abused her as well. So I think that having the relationship where she feels like the things that she's saying has actual power and meaning, that's going to be very important. I also think reinstilling hope is going to be very vital in this process. And lastly, I think it's going to be really important to really open up Saundra's eyes to the various strengths that she possesses and the resources around her that are available to her. Strength versus weaknesses. So for the trans theoretical model, one of the strengths that it incorporates various theories, allowing for a more diversified counseling approach. Um, Something else that's a big strength of this theory is the fact that it views change as a process and expects some confrontation and reluctance by the client in this process of change. One of the strengths of the strength-based approach is that it seeks to assist the client in developing resilience, which is a quality or inherent strength that is important really for any individual in the world to possess. But both of these theories as a weakness do not address the trauma Saundra experienced during adolescence, and really doesn't map out a means to work through that. So the approach that I would choose for Saundra is the trans theoretical model, because I do believe it offers more to her in regard to building up her self-image through the humanistic aspect, and then challenging some of the negative belief systems she has through the cognitive behavioral therapy.